Pre and post operative care. Question 1. A 48-year-old woman develops constipation post operatively and self medicates with the milk of magnesia. She is noted to have an elevated serum magnesium level. Which of the following represents the earliest clinical indication of hypermagnesemia? So the answer is loss of deep tendon reflexes. Question 2. An asymptomatic middle-aged woman is found to have a serum sodium level of 125 after routine laparoscopic cholecystectomy. Which of the following is the most appropriate management strategy for this patient? A. Administration of hypertonic saline. B. Administration of normal saline. C. Administration of sodium chloride tablets. D. Restriction of free water. And E. Diuresis with furosemide. So the answer is D. Restriction of free water. Number 3. A 52-year-old morbidly obese man with no other medical problems is scheduled to undergo an elective sigmoid colectomy for recurrent diverticulitis. Which of the following is part of an enhanced recovery after surgery protocol? A. Nasogastric tube until return of bowel function. B. Folace catheter for at least 48 hours post-operatively. C. Intravenous fluids until return of bowel function. D. Sugar-free gum 3-4 times per day. And E. Daily suppository administration. The answer is D. Sugar-free gum 3 to 4 times per day. Number 4. Following surgery, a patient develops oliguria. Which of the following values supports the diagnosis of hypovolemia? A. Urine sodium of 28, B. Urine chloride of 15, C. Fractional excretion of sodium less than 1, D. Urine or serum creatinine ratio of 20, and E. Urine osmolality of 350. So the answer is C. Fractional excretion of sodium less than 1, that is FeNA less than 1. Number 5. A 75-year-old man with unstable angina, peripheral vascular disease with symptoms of claudication after walking half a block, hypertension and diabetes presents with a large ventral hernia that he desires to be repaired. Which of the following is the most appropriate next step in his preoperative workup? A. Exercise stress test. B. Percentine thallium stress test. C. Transesophageal echocardiography. D. Cardiac catheterization. And E. Coronary artery bypass. The answer is B. Percentine thallium stress test. Number 6. A previously healthy 55-year-old man undergoes elective right hemicolectomy for a stage 1 T2 NOMO cancer of the cecum. He has a prolonged post-operative ileus requiring nasogastric decompression for 5 days. Physical examination reveals diminished skin turgor, dry mucous membranes, and orthostatic hypotension. Persistent lab values are as follows: ABGs pH 7.45, carbon dioxide 50, oxygen 85, serum electrolytes sodium 132, potassium 3.1, chloride 80, and bicarb 42. What is the patient's acid-base abnormality? A. Uncompensated metabolic alkalosis. B. Uncompensated respiratory acidosis. C. Respiratory acidosis with metabolic compensation. D. Metabolic alkalosis with respiratory compensation. And E. Combined metabolic and respiratory alkalosis. The answer is D. Metabolic alkalosis with respiratory compensation. Number 7. An 18-year-old previously healthy man with multiple fractures after a motor vehicle collision develops a left femoral deep venous thrombosis on hospital day 5 despite being on prophylactic low molecular weight heparin since admission. His platelet count was noted to have dropped from 385 on admission to 90. In addition to cessation of all anticoagulation therapy, which of the following is the most appropriate next management step? A. No additional therapy. B. High-dose warfarin. C. Low molecular weight heparin. D. Argatroban. And E. Platelet transfusion. The answer is D. Argatroban. Question 8. A 65-year-old man undergoes a technically difficult abdominoperineal resection for a rectal cancer during which he receives 3 units of packed red blood cells. 4 hours later in the ICU, he is bleeding heavily from his perineal wound. Emergency coagulation studies reveals normal prothrombin, partial thromboplastin and bleeding times. The fibrin degradation products are not elevated but the serum fibrinogen content is depressed and the platelet count is 70. Which of the following is the most likely cause of his bleeding? A. Delayed blood transfusion reaction. B. Autoimmune fibrinolysis. C. Inadequate surgical hemostasis. D. Factor VIII deficiency. And E. Hypothermic coagulopathy. The answer is C. Inadequate surgical hemostasis. Question 9. A 78-year-old man with a history of coronary artery disease and an asymptomatic reducible inguinal hernia requests an elective hernia repair. Which of the following would be a valid reason for delaying the proposed surgery? A. Coronary artery bypass surgery 3 months earlier. B. A history of cigarette smoking. C. Jugular venous distension. D. Hypertension. And E. Transient ischemic attack 3 years prior. The answer is C. Jugular venous distension.